Hello, hi, this is Dr. Erica. Thank you for joining me. I'm going to talk briefly about medications to avoid during gestation for those mothers who are recently expecting. So, I just want to go over a few medications and why we should actually make sure to avoid these. The first one is going to be laxatives. Laxatives, over the counter or prescribed, can be avoided because they do cause stimulation of the GI tract, stimulation of the bowel, and ultimately movement of the bowel. So we do want to avoid that particular class of medications. Instead, softeners, stool softeners are good. Vegetable stool softeners such as Senecal or Senocide is an all natural, it's vegetative, and it's all natural. It's known all over the world as a stool softener, and it works from 6 hours to 12 hours. So if you take it at night, in the morning time, you should be able to have a soft bowel. Those stool softeners are alternatives to laxatives during gestational period. The second medication I want to talk about are ACE inhibitors. ACE inhibitors are a class of medications that are used for blood pressure control, hypertensive disease states. So if you're hypertensive, your doctor should remove ACE inhibitors from your medication regimen and place you on a different medication that will help with uh, gestation and hypertension together. So again, avoid this particular drug class altogether, whether you're at first trimester or last trimester. The next class of medications that I'm going to talk about are the NSAIDs. NSAIDs are non-steroidal anti-inflammatory drugs on the market. They're over the counter as well as prescribed, and they should be avoided during gestation just because these particular medications during earlier stages, first trimester, second trimester, can cause a change in the formation of the actual unborn child. So we do want to make sure that that particular medication is avoided altogether. Also, another class of medications that should be avoided, if you want to take a pain medication, excuse me, NSAIDs are not okay, but Tylenol is okay. Tylenol is not an NSAID, and it can be used for pain occasionally. And talk to your doctor before choosing one over the counter to be sure that one is available that is specific for you. Now, the next class of medication is an antibiotic class called the tetracycline class. Now, this medication should be avoided as well in expecting mothers. Then the last class of medications I want to talk about are chemotherapy. Chemotherapy medications are medications that are used to get rid of cancerous cells out of the body to promote healthy cell living. So if you're expecting your chemotherapy, there is particular drugs of class that should be used instead. Okay. Also, there's a caution with prostaglandin medications. Prostaglandins should be used with caution or avoided altogether. Now, this particular medication can be used at certain times, but be sure that you're consulting your prescriber for for the best outcome. So those are the medications I want to talk about: NSAIDs, tetracycline antibiotic, also ACE inhibitors for blood pressure control, and then also, last but not least, the laxatives. All of those should be avoided during pregnancy or gestation and should be considered for uh, another class of medications for the purposes. So thank you for joining me on this particular video. Like, share, and subscribe. I'm Dr. Erica, pharmacist for close to 10 years. Please visit my website and also leave subscribe and leave a comment or any topic discussion that you prefer. Thank you and have a great day. Bye-bye.